Good day, doctors. Welcome again to another Simply Nature's Doctors Forum. We're so happy to welcome our existing doctors back with us again, and to our new doctors and new medical practitioners, a big welcome. Please take advantage of the Q&A tab at the bottom of your screen. So just type in your questions over there and we'll answer it during the Q&A segment of our discussion, after the main discussion. Today's topic is an important one. Diabetes is still a very big issue in Asian nations. And today we're going to share with you information that will help you treat diabetes more effectively. Throughout the discussion today, we'll be using polls to make the whole discussion more interactive for everyone. So we're going to start with our very first poll right now, which is, it's going to pop on your screen, how many diabetic patients or diabetic related patients do you see in your practice every week? The options are number 1, less than 10, 10 to 30, 30 to 50, more than 50. So just key in your answer and we will show the results of the poll in just about 2 minutes. And while we're talking about number of diabetic patients, we are happy to announce or let everybody know we just did a webinar for patients on the topic of diabetes, and this was done with Dr. Lewis and hosted by our very own Ms. Germaine. And it was so well attended. But what's really important is that throughout that webinar, the response was so strong. There were so many queries, not only about diabetes, but also looking for treatment to diabetes. And that's good news. So what that means for all of us tonight is that doctors, as long as you reach out to your patients and touch the topic diabetes, I am sure there'll be a strong demand for effective treatment. And that's what we're going to talk about today. All right, the poll results are here. I think it's pretty interesting, and I'm glad to see everybody has diabetic patients. And because of that, Simply Nature's protocols have been proven to be very effective for the management of blood sugar and hence treat diabetes. In fact, we're able to help patients manage their blood sugar so well that many of them have been able to reduce their dependency on insulin. Many of them actually getting off insulin completely, and for many of those, permanently. Now, apart from blood sugar control, there are other issues of diabetes, such as diabetic complications like PAD and renal failure. And even in those cases, we have patient cases where we have been able to reverse renal failure and prevent PAD scenarios. So we're going to share about that too. Today, I will be sharing a lot of data from pharmaceutical research, and a lot of it will be very important, I guess, to all the doctors in attendance tonight, which is the interplay between drugs like metformin and PPAR agonists, how it works together to treat diabetes and manage blood sugar levels. And of course, what's important to take note is that Simply Nature PPARs series is actually a natural form of PPAR agonists. So this interplay between drugs and PPAR agonists is a very important one. Now before we dive straight into it, let's see what's really at stake here. Number 1, diabetes is not a mild disease. Statistically, in the US, diabetes today is still the 7th leading cause of mortality. It is still the number 1 leading cause of renal failure and the number 1 leading cause of adult blindness. And the statistics in Asia is no different. In fact, take a look at this article from Endocrine Today. It states that in Southeast Asia, which is where Philippines belongs, adult diabetics over a period of 13 years are twice as likely to die from any cause as compared to a non-diabetic patient. So if you are diabetic over the course of this study, which is 13 years, double the amount of diabetics died compared to the non-diabetics from any cause over a 13-year period. And this study was done over a huge number of patients, 1 million patients to be exact. All right, so that's really impactful data. And not only that, in Philippines, we are ranked number 10. How I wish Philippines was ranked 10 for other things, but Philippines is ranked 10th for being the country with the most diabetic cases worldwide. We are ranked number 10. And in fact, 1 in 5 Filipinos are diabetic or pre-diabetic. 20.6% of adult Filipinos are diagnosed as diabetics. Again, diabetes is not a mild disease. It is a leading cause of adult blindness. It is a leading cause for late-stage renal failure. There's a 2 to 4-fold increase in stroke, cardiovascular arrest if you are diabetic. 8 in 10 diabetics die from cardiovascular related diseases. And last but not least, is the leading cause for non-traumatic lower extremity amputations. So with all these important complications, certainly for the patient, that diabetes is not a mild disease. All right, we've seen the complications of diabetes is, well, pretty serious. So one very important question before we look at the treatment of diabetes is this: can the complications of diabetes be mitigated, or can we reduce the patient's chance of developing complications in diabetes if we manage blood sugar, if we can successfully manage blood sugar? Take a look at the chart before you. You can see from this chart, if we are able to lower the glycated hemoglobin count from 9% to 7.2%, we actually see a 60% reduction in retinopathy, a 50% reduction in nephropathy, a 40% reduction in cardiovascular related diseases. So the answer is a big yes. If we are able to manage blood sugar, we can also lower the risk of all these diabetic complications for our patients. Now let's take a look now and jump right in to see how do we actually treat diabetes. The treatment of diabetes, conventional treatment of diabetes, the most common protocol and established protocol is the step care protocol. You can see from the diagram, it starts with diet lifestyle, which doesn't work for most Filipinos because we love our biko so much. We love our sweets, our milk tea, and that's really hard. So we naturally develop into, metformin, the first line of drugs, right? And then later combinations of drugs, both cholesterol, blood cholesterol, blood sugar, it all starts to come in, and then we come in with blood sugar, drugs, and insulin, and then finally total insulin dependence. Now the question we want to ask and address tonight is, can we actually reverse the process? We, as doctors, we may have helped many patients climb up the stairs. Now tonight, are we able to help the patients climb down the stairs so that they can actually live a drug-free life, or at least much reduced drug dependency? And the answer is yes, right? For a long time, doctors always thought that the cells that have given up or not working, insulin-resistant cells, the pancreas, right, pancreatic cells, once they are damaged for good. That was the old understanding. So it was always thought that you couldn't reverse diabetes, but that's no longer true. Research has shown, for example, beta cells in the pancreas, which is responsible for the production and management of insulin, can actually be revived, all right? It comes back again, and hence we can actually reverse the diabetes process, right? So it is possible to go down the steps. Today, we're actually going to look at how, with SimplyNature protocols, you can effectively help your patients come down the step care protocol. And this is attested by the thousands and thousands of clients and patients using our SimplyNature protocols in Southeast Asia and the rest of the world that prove that we can actually help them move down the step care protocols, and now they're living a healthy life free from drug dependencies. Let's focus on the key mechanisms which we can treat diabetes. PPARs agonists. What are PPARs agonists? Peroxisome Proliferator-Activated receptors. PPARs are the lipid-activated transcription factors exerting several functions in development and metabolism. So PPARs form a subfamily of nuclear receptors superfamily. Nuclear receptors are located directly on DNA inside the nucleus of animal cells, efficiently turning on and off in presence of a ligand. PPARs are validated drug targets. PPARs alpha being targeted for lipid lowering and cardioprotective effect. PPARs gamma for insulin sensitizing. In short, PPAR agonists are gene activators. PPARs turns genes on and off In the case of type 2 diabetes, the cells are insulin resistant, they are switched off. So you, just like this diagram over there, there's a bouncer over there stopping the insulin from being receptive, the cells from being receptive to insulin. PPAR works to remove the resistance, switching on the gene so that it will be insulin sensitive. And hence, the patient's own body is able to regulate sugar levels normally. Take a look at the following clinical data. Rosiglitazone, PPAR's gamma action. We can see clearly in the results with double-blind placebo that PPAR's gamma action in switching on the genes regulating insulin sensitivity. The glycated hemoglobin levels drop effectively. It's important to note that efficacy improves with increased dosage, as the chart shows from 4 milligrams to 8 milligrams. So does frequency in dosage, 4 grams twice a day versus 8 milligrams once a day. To all our current doctors, it is more effective for patients to take SimplyNature tablets twice a day, 10 micro tablets twice a day, rather than a single dose of 20 micro tablets. So when using SimplyNature PPARs micro tablets for patients, the base dosage is 10 micro tablets 2 times a day. Increasing the frequency to 3 times a day will see better results. You also have the option of increasing the dosage to 15 or 20 tablets per dose, and you will also see better results. Our SimplyNature tablets are natural superfoods with PPAR agonist content, especially the PPAR gamma action. They have been tested for LD50 and there is no long-term toxicity. In most of our clinical trials, patients take 60 micro tablets a day. So it is safe for daily and long-term usage. In fact, my family and I can attest to it personally. I take at least 20 micro tablets a day for the past 19 years. My blood works is nice and I benefit from good health, and also one of the best side benefits, which is anti-aging effect. A common question and scenario is, what happens if your patient is currently on diabetes medication? The good news is that SimplyNature PPAR works well together with metformin, one of the most common and predominantly prescribed diabetes medication. Let's move to our second poll today, which is, what percentage of your patients today are on metformin and they have indicated that they would be more comfortable to be on metformin while they try other protocols? The options are going to pop in front of you: 20% or lower, 50%, 70% or higher. And we'll just share that information when it's tabulated. Take a look again at this clinical study. It's very exciting for patients who are on metformin. You can see that metformin is the control, all right? And combination of metformin plus PPAR gamma action together actually improves the blood sugar control, looking at the numbers. So it's even more effective when you combine metformin with PPAR's gamma. Again, high doses of PPARs produces better results. So if your patient is on metformin, they're gonna see improved blood sugar control. And you don't have to worry about contraindications because there is none. Please take note, SimplyNature PPARs dosing is safe because its mechanism is the activation of your genes regulating your blood sugar control. So there is no concern for hypoglycemia. However, when we combine with metformin, we have to take special note of the metformin action. So make sure your patients are monitoring their blood sugar levels and adjusting their metformin dosage downwards as their blood sugar levels normalize through the PPAR gamma action. The action of metformin plus SimplyNature PPAR soft gel and tablets clearly illustrate how we can help patients reverse the step care protocol. So remember that steps that we saw earlier today? Now we have seen how we can actually reverse it. And literally from metformin and SimplyNature PPAR's combination to purely managing sugar through lifestyle and nutrition, which is through our SimplyNature PPAR tablets. So we know that PPAR's gamma activation can effectively treat diabetes, and we can do that using SimplyNature PPAR's soft gel or tablets. Soft gels are equivalent to 30 micro tablets in efficacy, so it's both a cost-effective choice over the tablets when your patients are going for high dosing. And it might be easier for some patients to comply due to their familiarity with just taking one soft gel capsule versus many tablets. And it could be more convenient for some patients. The next important question is long-term maintenance, all right? After the patient's diabetes is reversed and they now fall under IGT or impaired glucose tolerance, they have slightly higher than normal glucose levels, but they are not diabetic, so that's good news. We've successfully brought them down the step care protocol to lifestyle and nutrition. What now? Good news again. Take a look at the next chart in front of you. The results clearly show that over time, Pipas gamma activation provides long-term effective blood sugar management. Look at the results. The results are much better than the control after 2 years and beyond. So that means your patients, after they are now IGT, if they continue to take SimplyNature Pipas tablets, their blood sugar level over the next 2 years and even beyond is going to stay really, really healthy. The goal of our treatment is to reverse the step care protocol. And truly, with SimplyNature Pipas, our patients have a long-term effective solution that is nutrition-based. At this point, I would like to refresh everyone's focus to the beginning of today's discussion. If we are able to manage our patients' blood sugar levels, we are able to make very significant impact on diabetic complications, right? Just look at the chart. Patients who are currently suffering from diabetic complications have to use our soft gels at the very bare minimum, or the more potent extract powder, extract liquid, in order to manage or reverse these complications. But it is very encouraging because we've had many patients avoid dialysis. Even patients on dialysis were able to recover and go off dialysis. PAD cases have similar results too. Details for such complications can be covered in the Q&A segment of today's discussion. So if you have patients in mind, please type in your queries right now in the Q&A tab below. Before we close the main discussion, I would like to finish by highlighting the efficacy of PPAR alpha and gamma activation, both of which is achieved through SimplyNature products, and that they are not limited to insulin sensitivity, but also triglyceride lowering. Again, take a look at this original chart that we showed earlier in today's discussion. So our protocols would simultaneously manage the three most common metabolic conditions of cholesterol, sugar, blood pressure simultaneously. So we can handle the three musketeers of chronic illness, the metabolic conditions of cholesterol, sugar, and blood sugar simultaneously. So with the intent of keeping this discussion focused, we can answer questions about cholesterol and blood pressure again during the Q&A immediately after this. So thank you everyone for your time and attention. I hope today's presentation has given you the clear understanding and evidence of how we can better treat diabetic patients with SimplyNature protocols. And PPAR gamma agonists are potent and proven anti-diabetic compounds, and we can safely and effectively help our patients reverse their step care protocol that they are on back to lifestyle and nutrition. So thank you everyone for your time again, and let's proceed to answer your questions.